did you get involved with bariatric surgery, specifically when you were actually a general surgeon and a trauma surgeon?
That's back in history. That's like when I was young and brilliant before I got old and lost all my hair.
You were very impressive, I must say. You really were.
It's actually an accident. And I always tell the story, it was an accident. I was a trauma surgeon and I was an intensivist critical care specialist, and I used to work what's called a level 2 trauma center up in Delray, and I had my general surgery practice here in Hialeah, where I started the practice because I joined another surgeon. I was always from down south. I had never worked in Hialeah, but it's done me good. So I had a group of friends who work for the companies that make the instruments for the surgery, for all sorts of different surgeries. And one Saturday morning, we're supposed to go have breakfast, lunch at South Beach. And they're like, before we die, we have this seminar that we have to staff. Why don't you come by? A bunch of surgeons are going to watch laparoscopic, which is the new way of doing bariatric or weight loss surgery. And I was like, nah, it's not my field. It's boring, whatever. They're like, just come hang out, and then we'll all go have lunch. And I went like, yeah, okay, whatever. I'll go hang out. So I went to this meeting, and it was one moderator, and then there mostly was video live sessions. So the surgery is live, but it's through video from different areas in the country of all the bariatric surgeons. And bariatric surgery at that point was a small, very boutique practice. It hadn't taken off. So I sit there and I start watching some of the bariatric surgeons operate. I'm like, I'm not very impressed. But then one guy comes on and he starts doing this surgery, a gastric bypass laparoscopically. And I was like, wow, he's amazing. But the thing is, everything that he was doing laparoscopically, I had done before in trauma, in general surgery. So, in other words, he was dissecting around the stomach. I used to do that when I would do what's called Nissen's or reflux surgery. He was connecting the bowel. I used to do that in trauma when we would have to remove a piece of bowel or whatever. So sewing, I always did laparoscopic sewing. I was one of the first people that did it. And I was watching this thing and I was like, man, that is really, really slick surgery. That guy does amazing surgery. So I get up and I tell my friends, okay, I'm leaving now. I'll meet you guys for lunch. And they're like, so what did you think about this surgery? You don't like it, huh? I go, oh, no, I like it. And I'm going to start doing it. And they're like, what? And I'm like, everything that he did, I can do. And I get requests in my practice all the time, do I do bariatric surgery? And the answer is always no. Well, now the answer is going to be yes. So she was the office manager. I called her and I said, listen, the next patient that calls and says, do I do bariatric surgery? Tell him I'm going to start. Do you want to talk to me? What was her name? Maria?
Oh, we're not going to say the last name because
That's true. HIPAA.
Maria.
My very first patient, she came in. I sat her down and said, listen, I've never done this surgery. I took up a proctorship on how to do it, but I've done all the steps of the surgery many times. But you would be the first person I ever do bariatric surgery on. And she went,
she said, yeah.
Okay, doc.
When do we do it?
Let's do it. Short, run to the end of the story. Within a year, I was doing about 700-800 cases, bariatric cases. And at that point, I was doing so much bariatric surgery that I really didn't have time to do trauma. Because trauma call is you're in the hospital 24 hours waiting for anybody who is injured. And I was like, bariatric surgery is a lot more fun, it's a lot nicer. But people go to me all the time, did you do a fellowship? Like, when I came up, there were no fellowships. No. We came up with fellowships. We were the pioneers. So, to have an idea, at that point in South Florida, really South Florida, the 3-county area, Broward, Dade, Monroe, there were 3 bariatric surgeons in the whole tri-county area. And in Miami-Dade, I was the second bariatric surgeon to do bariatric surgery. So I was literally a pioneer. Now, there's a bunch of bariatric surgeons, different levels, different training. But yeah, I was, for this area, if you're one of the first 4 or 5, I guess you can consider yourself a pioneer, which is why I have the numbers that I have, because I've been doing it for so many years compared to some of the newcomers.
And luckily for your patients and for us, because we have you to ask all our medical questions too, your history in trauma, you kept those certifications.
Right, and especially what's called critical care. So to give you guys an idea, if you have surgery and you have a complication, be it your heart, your lungs, infection, whatever, you get very sick, you go to the ICU, the intensive care unit. The person that takes care of you in the ICU in most good modern hospital is an intensivist. It's someone who trained on how to take care of very, very sick people. Their lungs on ventilator machines, their heart on medications, all that stuff. That was my training as a trauma surgeon. That's my certification in critical care. So it doesn't happen often, but when one of my patients gets very sick, basically I go with them to the ICU and I stay there. I've done it actually one time the entire day until they get stable, their lungs, their heart, everything is working to get them to recover. And 99.8% of patients who have a complication, even though they can get very, very sick, recover. But one of the advantages of being an intensivist is I know the patient, I can go take care of my patient. I mean, the hospital has great intensivists, but they're taking care of 10, 20, 30 patients. My patients have one intensivist taking care of them that's there until I'm sure they're out of the woods and on the path to recovery.
So I was 23 years ago and haven't looked back since. So
I mean, it changed everything. My
those
practice,
amazing accidents.
our practice,
Yeah.
we built this together, and we developed our personal interest in the surgery, the other aspects of it, the programs, and we basically developed it. And as I said, back then there were 2 bariatric surgeons in this county, a total of about 4 in all the 3 counties.